All right, we're back again. I want to introduce my guest today, Dr. Betsy McCaughey, who is a friend. I've seen her around at Fox News and many other places. She's a writer. Everybody loves her. She's also the founder and chairman of Committee to Reduce Infectious Death. Very influential, certainly in reducing any kind of infectious disease. She was involved in the whole Ebola crisis. And Betsy, good morning, and thank you for being here.
Well, thank you. I am so glad we're going to talk about C.Diff because literally almost everyone listening to us has been touched by this terrible hospital infection. It kills 29,000 Americans every year. 29,000, that's like 10 World Trade Center attacks every year. And it's preventable through proper cleanliness and proper procedures, but mostly effective cleaning in hospitals and nursing homes.
So, one thing I can tell you when it comes to Betsy, she's very passionate. She's very energetic about any topic that she puts her mind into it. But look, as a physician in the hospital, we deal with C.Diff all the time. And I've seen patients, fortunately, not a lot of my patients, because we've cut down on all the use of antibiotics. We don't give as much antibiotics, etc. And also, if you've seen the floor at Lenox Hill Hospital that we built for my patients, it's basically they don't get mixed with everybody else. The cleanliness is tremendous, and I think everybody should follow that, and it works. Now,
I'm glad you're underscoring the cleanliness because let's get the facts straight. Antibiotics do not cause C. diff. We see more and more patients who contract C. diff, and they're not on antibiotics. What causes C. diff is poor cleaning, oral fecal contamination. What does that mean? It means traces of one patient's C. diff diarrhea gets into another patient's mouth. How could such a terrible thing happen? Inadequate cleaning. So we know that a patient is in the hospital. Picture yourself, you're touching the surfaces around your own bed, the telephone, the call button, the TV clicker, the over-the-bed table, and on all those surfaces is invisible contamination, C. diff left behind by previous patients. We know that if you're put in a hospital room and a previous patient had C. diff, your risk of getting it goes way up. That's the number one factor determining whether you as a patient contract this deadly infection. Who was in the room before you?
Betsy, look, over the years, I've seen the superbugs are coming into our hospitals, whether it's MRSA, whether this carbapenem-resistant Enterobacter CRE, which we've spoken about, and now you're bringing C. diff in a big way. The statistics is mind-boggling that you have 29,000 people die from
this
C. diff.
one germ. And by the way, New Yorkers are hit the hardest.
Right.
Patients in New York are being clobbered with this terrible infection.
So I didn't know that. And then that's actually a big news for me. And I don't want to scare people out there if you're heading toward any of the hospitals. But what should they be aware of? If I'm the patient going to the hospital next week, what should I look for and what should I do?
I say to everyone I care about, if you're going to the hospital to visit a loved one, a parent, a spouse, a child, don't bring the flowers and the candy. Bring a canister of bleach wipes and wipe the surfaces right around the patient's bed every day. You laugh. Dr. Robert Ornstein, head of infectious diseases at the Mayo Clinic, that's the one thing he did at the Mayo Clinic, and he reduced C. diff 85%. So why isn't every hospital doing that? Clean the surfaces right around the patient's bedside once a day with bleach, which kills this germ.
You know why I laugh? Because, as of a year and a half ago, every time we travel, my wife brings that bleach that you're talking about, and she starts wiping all the seats in the plane. And I used to say, like, stop, it's kind of embarrassing. But now, after she shows me, after she wipes out those plane seats, which is like a high traffic, a lot of people from all over the world sit there, and there are a lot of some of those fecal oral issues that you're talking about. You have it in the plane, you have it in high traffic places like the hospitals also, and these bugs. So that's why I think it's absolutely important.
And the other thing you can do is make sure that your patient, your loved one, has his or her hands cleaned before meals. Because here's how it happens. The patient touches the contaminated surfaces and gets that invisible C. diff germ on your hands. then your meal tray is delivered and you pick up the apple or the sandwich or the brownie and eat it, and you swallow those C. diff spores along with your food. Now, you see the signs everywhere, David, saying, please, doctors and nurses clean their hands, but there is very little effort in the hospital to clean the patient's hands. And so patients have these C. diff spores on their hands, and
That's a very
f-
good point.
that's a very good point.
Sh-
So help your loved one clean their hands. You need to wipe those alcohol-based hand sanitizers. Don't kill C. diff. You have to wipe your hands with a hot washcloth. Wipe the C. diff spores off before you eat.
Would you give me the summary of some of your research and recommendation? And we're going to post
Absolutely.
it on my blog, samadimd.com. Look for Betsy McCaughey, and we're going to take like a minute commercial. When we come back, I'm going to talk about her book called Beating Obamacare 2014. She's been a huge advocate of how the healthcare system is going down, whether Obamacare is right for us. She's going to talk about this, and I want to hear about it.
Thank
Betsy
you.
McCaughey and her book, it's out there.